So we'll go ahead and start our session today. My name's Kathy Ottenhoff, and I'm one of the Born coordinators on behalf of Born Ontario. I'd like to welcome you to our provincial rounds, the OMama Project, Mobile Health Innovation for Maternity Care. A question and answer period will occur at the end of the presentation. Please type your question into the chat box in the lower left-hand corner of your screen. Feel free to enter a question at any time during the presentation. As you've heard, these rounds are being recorded and they'll be posted to the Born Ontario website. So we're very pleased to have Wendy Catherine, the OMama Project consultant, presenting today. Wendy is an alumnus of the University of Toronto Master's Business Administration program and is currently principal consultant at Phoenix Health Consulting and CEO of Health Metrics Incorporated, an international maternal child health quality consultancy. Among the first regulated midwives in Ontario, Wendy provided reproductive health care for 15 years before joining government to lead healthcare improvement strategies. Wendy is passionate about improving care for women and as an innovator and advocate for quality and value in policy, led projects that included midwifery program, Born, the Provincial Council of Maternal Child Health, Prenatal and Newborn Screening Ontario, among others. Wendy is a published author and speaker on the subjects of healthcare quality, midwifery, child health, and maternal health. So a warm welcome to you, Wendy, and I'll hand it over to you.
Thank you very much, Kathy. It's really a pleasure and an honor for me to be presenting to all of you today. I am going to ask for a little bit of assistance from my colleagues who are working on the Archidin to advance the slides for me, and that'll help, I think, deal with some of our technological challenges. So I'm going to look at the agenda slide 2, and what we're going to be working on today is discussing an overview of the OMama Project, how it contributes to Born's mobile health strategy, what is going on in e-health innovation, particularly in the area of maternity care and how OMama might be able to fit in with that, how we're keeping women at the center of the project, and looking to the future. I'll be moving to slide 3. The OMama Project background is actually much longer than me. There were folks that were involved at Born and at eHealth Ontario prior to my joining the project. The project was officially kicked off in early 2014 through Born Ontario and the support of eHealth. And we are working on a plan for a 2-year project, which we hope will benefit the maternal child population and help us learn a lot about mobile health in the context of this population. OMama fits under Born's strategy to engage women through mobile technology, and it is one of the many activities, as you'll see on slide 4, that Born is focusing on under its Born 2020 strategy, in addition to its registry functions. So this is a real opportunity to break new ground. It is a real marriage between women, data, and maternity care. And it is teaching us things every day about how we can improve the way that care is delivered and how we can continue to ensure that that care is properly reflecting the needs of women in our province. Looking at slide 5, we have a number of project goals, and I've provided this slide because this kind of comes right off of the project plan. But looking at slide 6 for a more concise description, this is what we're going to be doing in our 2 years. We're going to be listening to women. We're going to be building a website and an app, which is where we're focused right now. A little bit later in the project, we're going to be building a personal health record, which you'll see referred to throughout the slides as PHR. We're going to test and evaluate these 3 different modes of technology, particularly from the perspective of how women use the technology, how they like it, and does it really contribute to better engagement in their maternity care. And we're going to publish those results. The project structure, which is listed on slide 7, is a combination of Born's project team and a number of experts from the area of e-health innovation, evaluation, and also a membership list, which is our advisory committee that is on the following slide, which represents a range of very eminent maternity care providers, technology experts, and others who have been getting together monthly since the spring to discuss and develop our plans to build these tools. We've had some really interesting conversations about what's in and out of scope for OMama. This is such an innovative project that people's plans and the environment itself is changing so fast that we've had to be quite clear about what we can and can't do within the timeline and the resources that we have. While e-health technology, and I'll be showing some examples of that shortly, has been galloping at a pace that has even put our environmental scan of just a couple of months ago already out of date. We are constantly adding new examples of mobile health technology to our environmental scan and learning more about innovative ways that mobile health technology is being taken up by different populations. I just got my iOS update on my iPhone and saw the new My Health app right in there. And there's all different kinds of Fitbit and other measurable technologies that are increasing the reach of technology to serve and interact between people as individuals and their healthcare providers. So this is what we figured that we could accomplish within our 2-year period and learn from in a way that would best inform Born and eHealth. So what's in scope? We're going to be building some innovative technology. Specifically, we're going to be joining women, providers, and the information together. We want a simple and elegant design that's easy to use, and we want to select content that's relevant to women across the maternity care continuum. So that would include preconception, all the 3 different trimesters of pregnancy, labor and birth, and an early parenting and newborn phase. We want to make sure that the solutions that we come up with are scalable in the event that we think that this small pilot project could be later funded and expanded to the provincial context. So what's out of scope? We wish we could immediately be able to provide an interactive and electronic health record that would solve everyone's concerns that we've had a long time, that maternity care, one of our commonest examples of healthcare in Ontario, could be brought onto a uniform technological platform. We're not going to be able to do that yet, but certainly the solutions that we're building should be able to be bridged to a later EHR, and we're very hopeful that they will be after the end of the OMama project. We'd also hoped that, and some of us are quite passionate about wanting to reduce inequities in healthcare by being able to provide OMama solutions immediately in the multitude of languages that reflect the languages, ethnicities, and regions of Ontario. So now we're going to be starting off with maternity care information in English only, and we hope at later stages of the project to be able to broaden that and to tailor it to the different kinds of needs of the populations, particularly those at risk of different maternity care complications or who have difficulties in access to maternity care already. We had also hoped that maternity care advice might be able to be offered for all aspects of care. And certainly we're building from a scope that will include information for healthy, normal, low-risk women and build out from there, possibly to later populations of women with particular specific needs or high risk, multiples, etc. But for right now, we are looking at the largest group, but the lowest risk, healthiest group of women who would be planning a pregnancy or pregnant now in Ontario. We know that Born has the leading most repository of personal health information on maternity care in the province. And it's certainly tempting to immediately want to begin to link to that information. We'll have a lot to learn about privacy and about keeping that information very safe through the OMama process. But for this part of the project, we're not going to be linking to Born's registry. And the other thing is we'll certainly be studying OMama, but this will not be the sort of foundation of a large cohort clinical study. Moving on to slide 10. What we will be doing, however, is looking at pieces of information that we can provide to women and have them interact with that represents a number of different milestones along what we're calling the maternal pregnancy pathway or the maternity care pathway. Here's a visual example of it on slide 10 with a very small number of the kinds of what we'd call events that women might engage with over the course of their pregnancy. We're looking at approximately 50 to 60 events being on our maternity care pathway for the OMama Project. And those, as I said, would range from preconception all the way through to a post-birth parenting and newborn scenario. I've provided another example of a provider pregnancy pathway, which is something that as providers we're quite familiar with looking at from the standpoint of how do we deliver prenatal and postnatal care, how is perinatal care structured, and these are the kinds of screens and some examples, also very high level, of the type of interactions that maternity care providers have from their perspective. But as you can see, the differences between the two, it's really women's experience that we're focusing on here with this pathway and what women need and how they're going to be able to access that information and education rather than just that information from the provider's standpoint. So we are certainly already scanning for the authoritative information that OMama will provide, and we're certainly finding that the majority of that authoritative information is written from the provider's perspective. You won't be surprised that there are numerous gaps still, but most of the information is on clinical practice guidelines at a very high level of literacy tailored to the needs of healthcare provider professions, and that the information is often structured according to decision tools and other research methods that really are for the provider. When we look at what's available for women, there's only very few resources actually, and often they're not necessarily evidence-based. So we're in a hunt perpetually now for very good, authoritative, but women-centered information that we can load onto our maternity care pathway. We're following on, I'm moving on to slide 12 now. We're moving on to being able to first also look at what kind of technology examples are already out there that the healthcare system is incorporating onto mobile health technology. And I've given a couple of examples here on slides 12, 13, and 14 and 15 of examples that are out in the marketplace now. Some of them do relate to women's health. None of them specifically relate to maternity care, but they are all examples where information on the back end of the technology is being translated through to the user, and someone can pick up their cell phone and be able to input information and obtain information about a particular health concern. One key one, so the first one, breast check. The second is a heart and stroke. The third is a patient passport, which does enable quite a bit of information to be input and collected and exchanged on cancer care. And the fourth, which is something that is in play in Ontario, many family health teams have purchased this proprietary product called WellX, and it's a secure email service where patients and their family physicians or other allied health providers within the family health team can enroll together and exchange information, including secure lab results and other kinds of information, and where a patient and her healthcare provider can email back and forth about her care and exchange information without being seen in the office. So this is one of the technologies that we hope we will be eventually able to incorporate in one of the OMama solutions in the personal health record. And we're looking at other ways based on some of the examples up above of how women will be able to see, register, and exchange information on maternity care. Moving on to slide 16, one of the first things that we did after conducting our initial environmental scan was looking at women's priorities themselves. And we wondered whether or not we'd be able to engage with a lot of women, seeing as we're a relatively small pilot project. And, given familiarity of pregnant women and the abundance of social networking information about pregnancy and birth, we thought, well, why not try Facebook as a way of reaching out? These are the two links to the Facebook page for OMama and also the SurveyMonkey tool that we use to collect information from women based on a survey that the advisory committee and its working groups designed. We piloted and tested that at Born first, and then we rolled it out for a month in order to see whether we might get a few women coming onto that survey and telling us directly what they thought we could tell them about maternity care based on their needs. What kind of information could we collect for a maternity care pathway? We were really surprised and so grateful to not only our advisory group, but the stakeholders in the Ontario community and women themselves, some of the staff and other friends of friends who, some of us used our personal Facebook or LinkedIn pages to broadcast these two links. We had some great participation from our provincial and national partners around putting these links on their own web pages or tweeting them out with their own communication strategies. And we were surprised and thrilled to find a response in that month of over 1,100 women and maternity care providers that responded to our survey. You can still see it now, but it is closed from the standpoint of the results that we'll obtain. And we were thrilled to receive incredible information from women about what they thought the most important topics of information were going to be that OMama could collect for them and curate for them on our solutions. We had a great and broad representation of women in terms of age and parity, and largely English was the first language. We're not surprised about that because it was broadcast in English only. And an example on slide 18 of the kind of results that we got was just, would be one snapshot of one of the survey questions where we asked on the preconception stage of pregnancy only, and we listed about 20 subject headings. What were the ones that women thought were the most important ones for them to know about? We could see very clearly based on the SurveyMonkey results which ones women were interested in most. It's prompted some really important questions for us about how many and how much information is available on each of these when we went hunting for it. And it also posed some important questions about which ones and why didn't they pick. And you'll see some of the ones at the bottom that include intimate partner violence, alcohol and marijuana, which may still have some very important clinical relevance, even though those might not have been the most popular picks among the respondents of the survey. So we're right now dealing with our advisory group and the experts there to look at what information is the best information that would be tailored to our population, which ones should be the first group, and we're looking at a combination of the ones that are in the upper circle or the oval, but also how we're going to cram in some of that excellent content that we think women should be able to access through OMama on a provincial site. Looking now at slide 19, we were also able to analyze from the survey not only what kinds of maternity care providers, as in these were the other ones that weren't obstetrician, family physician, midwife, and nurse that did participate in the survey. So we were thrilled to have that wide range of input. But also in slide 20, we were able to access hundreds of comments that women gave us on the kinds of information that they wanted to have based on changes and improvements to maternity care. So information they were not getting through the typical modes of engagement. And access was a great big one. So we heard over and over again that, finding a care provider and making sure they knew where to go to get one, information on birth and breastfeeding, decision supports about prenatal classes, midwifery, and, you'll see some of the other ones there. The size of that font is a trick that SurveyMonkey does. I don't know if all of you have seen these, but the size of the font represents the frequency with which women use those words in their qualitative comments to us. So we're able to get a sense, very high level and very quick snapshot of the themes that they were interested in. On slide 21, this was another one where it was a bit of a perspective for us in terms of the kinds of things women did not think they got enough of, or they were having difficulty finding information on these items and wish they could get more. So using this information that women gave us, and we have more than 40 slides on the quantitative information on the subject headings, as well as numerous more slides on these thematic qualitative results, we're using that to populate our pregnancy pathway. And it is a bit of a fill-in-the-blanks exercise. You'll see the stages of that kind of process below on slide 22. And we're right now working on the circle area. That would be once we've sort of scanned the environment for the kinds of information that are out there, and that includes excellent clinical practice guidelines by some of our specialized professional associations and other groups whose mandate that is. So, we're not in the business at OMama really of content development. These are very specialized skills. They take a tremendous amount of time and resources to produce very good, authoritative clinical information. So we're looking at appraising evidence out there, and we're looking at plotting the right information onto the pathway, starting with those subject areas that women requested. We'll be choosing milestones that sort of fit with the flow of pregnancy and making sure that there's some content in each of the sections. And then once that content is set, we'll be providing that to the vendors who built the solution so that they can add that right in as a script. On slide 23, you'll see some of the specifics of the information that we have to provide to the vendor. It's quite an encyclopedic, very precise kind of process. We can't be vague about what we're giving and just say, this is about the first trimester. We have to really look at what's the subject, what's the introduction, how exactly at what week we think the woman should benefit from engaging with that information, as opposed to when does the event actually happen. In some cases, for example, with prenatal screening, we want to have information available to women even earlier than when the test might be done, so that they have time to consider and learn about the positive benefits and also risks of any of the clinical types of choices that they'll be offered. And then we're looking at up to 2, 3, or more resources that we'll be able to curate for them on the website and app, based on whether it's a website, a mobile friendly type resource, a link, a PDF, or a video. And we think that based on the different kinds of information out there, that we'll be able to provide some information on all the subject topics. What we are finding is that there are some notable gaps in provincial information that just haven't been written, certainly not at the women's literacy level, and also haven't been written in one place. So even something which you would think is so basic as choosing a maternity care provider, these are links to different websites that have different descriptions of individual healthcare provider scopes and credentials, different kinds of descriptions of the kind of care that's received. And there actually isn't one provincial place in Ontario where you can say, I want to get maternity care, what are my choices? So in that case, for that one milestone, we may wind up for now having up to 3 or 4 different resources that describe the different professionals and what they all do. But one of the biggest contributions we think OMama can make is going to be to identify which key areas of information may be priorities for our professional associations, healthcare partners, government, LINs, etc., for them to work at these next and possibly be able to improve the overall repository of health information in Ontario for this population. Our recent progress, which is slide 24, is that we've brought a vendor. The vendor is called eSolutions on board. We are working on the app functionality and design, as well as the website and design. A group of our advisory committee members were just at a workshop for 2 hours this morning, mapping the different maternity care topic areas to a website design template. And as I said, we're working on content collection. And so far, so good on the budget, which is really great. The app architecture and wireframe process is ongoing, and that's a very exciting process, which actually does involve sketching out what the mobile phone application is going to look like. You'll see some sketches right here on slide 25. And we are moving from this kind of chalkboard process, determining what the potential screens will look like, what the images and photos we can use will look like. Born is currently undertaking a branding exercise itself, and so the OMama brand will be closely linked to the Born colors and look and feel. But you don't even have to worry about that at this stage of the design process. You're really looking at what kinds of screen shapes do you want, and is it going to look more square or round, and how will the buttons interact with each other. And it's a lot easier to do that kind of design on a chalkboard or eventually on a computer screen than it is to actually then program that in and work with it in real time. So we're moving now from the wireframe process shortly into the actual technology design process. And looking at slide 26, this is an example of a sort of finished product where we would move from the sketch page to the technology look and feel. And of course, this would then be tested, and we'd be using images that we hope will reflect the diversity of women and families in Ontario, as well as settings and clinical care providers. Looking at slide 27, this is an example of the real-life draft wireframe dashboard for OMama. This is something that's in process, and we're looking at how women will see and interact with their own image, an image potentially of an avatar that they can create, a kind of image or symbol of some kind of size of pregnancy, and the information that we're looking at collecting from women for this phase of the solution will be limited to their birth year. So by that, we'll be able to calculate their age at the time of delivery. We're not interested in even specific information like their birth date. We don't need that. We can provide a drop-down menu that says they were born in 1970, and that'll give us an idea broadly of the age grouping that they are within. As well, we will be asking for their estimated due date and provide a little calculator so that they can figure that out using either their last menstrual period or their conception date. And when they put that in, we'll know at any point when they open the app what week of pregnancy they're at and what information might be most relevant to their stage. And the last one would be what number baby they're having. And again, by drop down, you can put first or subsequent, and there may be some information that we can tailor to those populations that will show up in the form of a text reminder or a particular kind of advice that may apply to multiple climates differently. So for now, with those three pieces of information, we can already start to tailor information in a way that would be more engaging with the woman as an individual than a website where there's no need to enroll. You can search around and browse to whatever content you want. Between the website and the app will begin to start helping women sort of zero in on the information that might apply to them by age or parity. And eventually, where this is going is she may be able to provide more information, say on our third solution, a personal health record, that will provide much more ability for logarithms to be built, whereby information could be drawn for her, not just as someone having a first baby or someone who's 36 years old, but someone who has a particular genetic or medical history, a particular region of the province, a particular language or ethnicity group, and be able to really zero in on information not only tailored to her group, but tailored to her as an individual. Long outside the scope of this particular phase of the project, but within range of our vision, would be actually tailoring information from the Born Registry, whereby her past pregnancy, birth, and postpartum information, including potentially her genetic history or her newborn screening, could actually be called up by that technology, and she could interact with it in the form of information that would advise her on a current pregnancy. So the depth of this is pretty endless. but we are really staying within our scope right now to stick with those three pieces of personal information as a way of testing how do women like that kind of technology, how can we protect the need for privacy in the course of any future development or introduction of personal health information, and how do women feel about using this kind of technology for maternity care engagement. So moving on to slide 28, looking to the future, we're certainly imagining that there could be OMama 2.0 and further, but we're going to be sticking with our current objective right now, which will be to really work on 1.0, the website and the app, to procure a vendor to design our third solution, which will be the personal health record. We're going to be piloting all three solutions for 9 months and evaluating those results. We are thrilled to have the support and the engagement of our provincial stakeholders as national partners as well. There are apps and organizations coming online all the time that are finding out about OMama and very interested in working with us to help us or to have our technology help them in their solutions. So it's quite an open process of innovation. And we'd love to take your questions as well as invite you to participate in any way that we can incorporate that, including working with you if you are a pregnant woman or interested in pregnancy and want to be one of our subjects for future outreach for our evaluation as a maternity care provider, or if you have access to clinical care sites where you might want to promote women to test our products, and also in organizations and institutions around the province where you might be able to advise us on how it's going. We're very interested and are going to be continuing to engage our partners throughout the project. We've got about 1.5 years left to go. And I'm thrilled to take your questions now and have you tell me how you'd like to be involved.
Thanks, Wendy. So just a reminder to everyone, there's a chat box located in the bottom left-hand side of your screen, so feel free to type your question. There was a question entered a little bit earlier, Wendy, and I think you might have just hit on that with your last statements there, and it says, is Born looking for test sites?
We are most certainly looking for test sites, and although the Facebook survey was a great way of engaging women in that, I think we'll be wanting to find out by combination of focus groups and possibly also even clinical care provider focus groups what women and care providers are thinking after they've used OMama. And we're in the process of designing our evaluation methodology now. So if you're interested in being a test site or in some other way can coordinate either women or care providers as a group to be able to give us feedback, we'd be thrilled about that. So please do, yes, let us know about you, how we can connect with you. My email and contact information is on the last slide, but you can also contact Born or just omamaproject@gmail.com. That's my email on the project, and you can let me know how I can get in touch with you.
That's great. Thanks, Wendy. So I have a quick question. Is the app available on any type of phone?
It will be available on multiple platforms, and it will be available on the App Store. It's not there yet, but yes, we're looking at a range of different iPhone, Android, possibly BlackBerry as well. And we're aware that with these technologies changing so quickly, one of the things that we wish we had more sort of pre-study is we have some idea based on market share what different groups of the population are using in the form of their handheld phones. But we certainly know that within the maternity care population, that might be different. It might not apply. So we know from other experience, for example, the Pregnancy Passport app that was developed by one of our advisory committee members, Marissa Cicero, and her team at St. Mike's Hospital, and they developed a mobile phone app to help women who were quite high risk and had some socioeconomic status risk factors as well. And they found out that those women were using a very particular kind of phone that had a pay-as-you-can phone plan, and they designed their app specifically for that phone. So I think among the pregnant women of Ontario at any given time, we have a lot to learn about the kind of phones and technologies they're using. We made it really clear to our designers that we needed a technology that would allow women to walk with a stroller with one hand, carry their phone in the other, and scroll with one thumb so that they could get the information that they need, or while they're breastfeeding. So it has to be really, really simple to use, with a very small number of clicks to the information that they want to find. And we think at the moment, with technologies converging, that we'll be able to provide at least 3 platforms as a start.
That's great. Thanks, Wendy. Here's a question. Where is the data entered and the device saved? On the cloud server only or in the smartphone itself?
That is a really good question, and we've been considering whether or not we were really staying away from the idea that anything's going to the cloud at this point, because we wanted to make sure that for now, these 2 solutions as a start, we weren't releasing much information up to be, out there, so that it would be accessible by anyone else. Most of this information, all of the information, we believe is going to be on the phone itself. But there are some applications that we've been looking at that do a combination, and eventually, just given how much space is on a phone, we might be getting into volumes of information that exceed what a typical phone can hold. So for now, I think we're looking at just the smartphone, but some of our research into privacy and cloud and other kinds of remote technologies are going to necessitate us looking at, as we get into the personal health record, how will security and privacy be ensured for women who are putting additional personal health information in there.
Great, thank you.
I hope that answered your question, Joan. I'm starting to see the chat boxes now.
Are you? There's another question there that you can probably see, Wendy. It says, Brittany's wondering if it's only available to women in Ontario.
Like our Facebook page, anyone can get there. So we don't really have any way of knowing at this point where exactly women are giving us the feedback. But the information that we will be offering on OMama will be tailored to Ontario, and that's pretty important. We're going to need to keep some kind of qualifier on the front page of the tools when women would access that, to say, this is who this is meant for, which audience we're targeting, because there's some information that might just be different. So, for example, on newborn screening, we want to have the information that's there about making a decision and what tests, et cetera, are offered, but we're going to have the OMama page point to the Ontario newborn screening program right here at CHEO, and that's important because that particular program offers different tests than just about every other province in Canada. So that information won't apply to people who are using the information from other locations. Even in some cases, some of the information that we are offering, for example, on birth centers as a setting, is only available to the people in the communities where the 3 birth centers in Ontario are. So there will be some, I think, introductory limitations to the kind of information. That said, nausea in pregnancy is pretty typical no matter where in the world you are. So a lot of the information will be applicable physiologically to women all over the world who can access it and who can read English. But most of the information that we're looking for, if we can find a site that is applicable to Ontario women and is specifically about care here, we're gonna prioritize that content for them.
Mm-hmm. Thanks. One here, are you taking into consideration the baby-friendly initiative? So
absolutely. Yeah. One of the biggest elements that women told us was about information that they wanted on pregnancy, and would be very, very important that we have up-to-date information on the leading most initiatives. So absolutely, BFI would be one.
Great. I don't see any other questions in the chat box. Just while we're waiting for a few minutes, I'll just make an announcement about our Born conference. So I think most people are aware by now, Born is hosting a 2-day conference, the right information in the right hands at the right time, using data to improve maternal child care and outcomes on February 6th and 7th at the Fairmount Chateau Laurier in Ottawa. Registration is still open and will be until the day before, Thursday, February the 5th. So if you'd like more information on our conference, please feel free to visit our website at bornontarioconference.ca.
That's great. One of the things I would really like to put out a little plea for, if you don't mind, Kathy, is images. We are very interested in being able to give our designers a wide range of high-quality digital images of women, care providers, newborns that would have to have permission. They'd have to give permission to using those images on our site. So we've asked, a number of our leading stakeholders as well, if they can provide us with some digital images to reflect, as I said earlier, the diversity and ethnicities, family compositions of families in Ontario, as well as settings and care providers. So we want to have quite a good range of images to be able to choose from, and they're not easy to find, specifically not in lab coats or women cut off at the head or large bellies, et cetera, specifically in key poses. We want to have women in home settings and families of all different kinds, as well as different care providers in different settings offering maternity care in Ontario. So if you have images that you'd like to share with us, and you can ensure by providing us with written permission that we can use them for our OMama sites, we will most certainly send them to our designers and consider them for use on the website and app. So I'd be thrilled if any of you want to contact me about that, if you have images about your own care, or if you are in a position of having a library of images that have been pre-approved for use, we would be grateful to be in touch with you.
That's great. Invite for everyone to show off their babies.
Yeah,
that's
or
great.
themselves.
And themselves, yeah. It's perfect. And their families, maybe.
Mm-hmm.
So that's good. Nothing else in our chat box. So one more announcement. Our next scheduled rounds are February 19th. Our topic will be enhancing immunization data collection in Ottawa through Immunize CA app, so another mobile phone application presentation. We will hear from Dr. Kumanan Wilson, co-developer of the app, and Alicia St. Hill Nasser, Born Manager of Health Informatics, on the app's purpose and features, and hear about the project's collaboration with Born. So we're looking forward to that in February. And we're almost out of time, and I don't see any other questions in the chat box. So I want to thank you, Wendy, very much for a great presentation on the review of OMama Project and helping us to understand the development of the mobile health tool and upcoming plans to pilot and evaluate it. So thank you again. And thank you all for your attention, and we look forward to you dialing in again in February.
Thank you, everyone.
Bye, everyone.